Good morning, dear colleagues. I welcome you to this morning session about prostate cancer imaging, the essential guide to radiologists. And I'm very happy that so many people already in the morning come to this session. I will first give you some introductory words and some slides. What is the arena we are talking about? And then we will go into the different talks. First of all, what's that? You know that prostate cancer, meanwhile, is the most common cancer in the Western world. And as you can see, it is distributed mainly in the industrialized countries. We don't know why that is. The only thing that we know is that when people are moving from the from the countries with the lower incidence to the countries with the higher incidence, that within one single generation, the incidence rises. So there must be anything in our society that promotes prostate cancer development. This is the incidence. When you now look at the mortality, you see that the mortality is not leaded by prostate, it's by lung cancer still. And so we have the problem here that during the last 40 to 50 years, the incidence about tripled, but the mortality is about the same. We'll learn a bit more about this. And the problem that arises now is the question, is there an overdiagnosis? Is there an overtreatment? Of course, we know that we should detect prostate cancer early and we should treat it, but we should not treat all the patients. And the question is now, how can we select the right patients? How can we now do a kind of a guessing of the aggressiveness of the tumor? Prostate cancer is mainly developed in the peripheral zone of the prostate. And we know that in this area of the peripheral zone of the prostate, that is here assigned by a D, there's also a chronic inflammation seen by the pathologist. So there is a hypothesis. It's still a hypothesis, but there is a hypothesis that it could be based on a chronic infection of the prostate. And there will be some other factors, of course, but it might be that a chronic process is going on in the prostate, and this is supporting the fact that most of the cancers are multifocal and very heterogeneous in their aggressiveness. So we have to be aware that we look at the chronic disease of the prostate. When we now see what imaging can do, then we have to have in mind that there are specific biological cancer hallmarks that are involved in all cancer types. And there are not only the cancer cells for itself, there are also inflammatory cells that are promoting the cancer development. There are vessels that helps the neovascularization to bring in oxygen and food to the tumor. And how can we image that? With multiparametric MRI, we are able now to see these changes. You see an T2 weighted imaging of the prostate, you see on the right peripheral zone, you see this high signal intensity on T2, you see unspecific changes on the left side. What is going on there? When we have now diffusion weighted imaging, we identify areas with increased cellular density. When we do the contrast-enhanced imaging, we see areas of neovascularization. So within that area of the chronic unspecific changes, we may identify with imaging the parts of the process that is the most aggressive part that activate invasion and metastasis. So we have now multiparametric imaging, and you will learn much more during the session now. And the question is now, with these tools in our hand, what can we do for the patient? And there has been a publication in 2009 already by a urologist, not a radiologist, a urologist from King's College in London, and he raised the question, is it time to consider a role of MRI before prostate biopsy? It was very hard to get that publication published, because of course we know that there is one enemy we are all now have, and this is how can we finance this imaging in the most common cancer in the Western world. However, there are lots of questions now. We are standing, and you all are faced with that, all the patients, all the physicians, all the urologists. How should we now proceed? Should we do PSA testing? Should we do imaging? By which modality? Should we do prostate biopsy? How should we guide the prostate biopsy? How should it be treated? Prostatectomy? Should it be robotic surgery? Whatever, HIFU, local therapy. There is really very, very hard to find the right way through this jungle. So, prostate cancer management is a complex challenge with a huge medical and socio-economical impact. And so it's very important that we now discuss in this round this very important topic. And I'm very, very happy and honored to now introduce to you very distinguished speakers. First of all, we have a talk about the clinical arena, when and how to treat prostate cancer, given by Professor Schröder. He is Professor Emeritus and Chairman of the Department of Urology in Rotterdam. He is also heading for almost 20 years the famous European prostate cancer screening study. The second talk is given by Professor Hedwig Ritschak. She's chairman of the Department of Radiology in New York. You are all aware of Hedi Ritschak. I think I don't have to introduce to you, to the audience again. She's one of the pioneers of prostate cancer imaging, multiparametric imaging, since the early 80s when there was a dawn of MRI in our community. And the third talk will be given by Professor Corny. He's a very experienced prostate cancer imaging specialist. He's a radiologist in the René Descartes Medical University in Paris. So I'm very happy that we are now able to discuss with this honored guests this very important topic. And I hope that you will all learn a lot and make your comments, and probably we can have an interesting discussion after the talks. So then I think we will start, and I will ask Professor Schröder please to come to the podium and give us his talk about the clinical arena, when and how to treat prostate cancer. And I'm looking very forward to your talk. Thank you very much for coming.